Good afternoon, and welcome to today's webinar, How PFAS Activism Has Shaped Public Health Policies in Massachusetts and Beyond. My name is Michelle Dixon, and I am the Program and Development Director for the Massachusetts Breast Cancer Coalition, and I would like to thank you all for joining us today. I'm very pleased to welcome today's speaker, Dr. Jennie Liss Ohayon. Dr. Ohayon is a research scientist at Silent Spring Institute, specializing in environmental policy, community-engaged research, and environmental justice. She researches the emergence of scientific and activist concerns around industrial chemicals with Northeastern's PFAS lab, and, in collaboration with the University of California, Berkeley, is evaluating the effectiveness of California-based legislation that aims to reduce exposures to toxic chemical substances. She is also working on projects to report back to study participants and community partners in the US and Chile their exposure to endocrine disrupting chemicals. She recently partnered with MBCC to translate environmental health research into a hands-on curriculum that helps students across the state reduce their toxic exposures. Dr. Ohayon completed her PhD at the University of California, Santa Cruz, researching the remediation of toxic waste in military Superfund sites. Jennie, welcome.
Great, thank you so much for that introduction. Hopefully everybody can hear me right now, but as Michelle mentioned, I am a research scientist at Silent Spring Institute. I'm also a researcher at Northeastern University's Social Science and Environmental Health Research Institute, and I will be talking today primarily about work that I've been doing with Northeastern as well as Silent Spring. And I'll be presenting on how activism has shaped science and policy around PFAS. PFAS is a class of chemicals that poses a significant contamination threat in communities across the US. And the title for this webinar, Persistent Chemicals, Persistent Activism, it's actually inspired by a quote by a collaborator and PFAS activist, Andrea Amico. She stated in a TED Talk on PFAS that her activism really needs to be persistent given how environmentally and biologically persistent these chemicals are. All right, I'm just trying to switch slides, but it seems frozen. There we go. Okay, so as an outline for the webinar, I will give a bit of a background on PFAS. I'll talk about contributions of activism to the scientific and policy landscape in the US. And then I'll also share resources that you can use in your own activism or in your own concern about PFAS. So to start with the background on PFAS, in the past few years, there's been a huge uptick in media attention on this class of chemicals. You might have come across headlines such as nearly half of private wells sampled on the Cape have PFAS, or what are PFAS chemicals and should I be freaking out about it? So news articles have covered everything from how large chemical corporations such as 3M have sued the state of New Hampshire over their PFAS drinking water standards, to conversely how 3M has agreed to pay the state of Minnesota $850 million to settle a state-initiated lawsuit about widespread contamination in the state. So what are PFAS? They're a large class of approximately 6,630 chemicals. They contain chains of fluorinated carbon atoms. Historically, two compounds out of these over 6,000, PFOA and PFAS, were most used commercially. Both were studied by industry for toxicological and exposure concerns beginning in the 1960s. So for example, chemical giants DuPont and 3M, they conducted studies that linked PFOA to testicular, pancreatic, and liver tumors in lab animals and prostate cancer in their factory workers. Chemical companies, however, they hid the data about concerning health effects and the extent of public exposure. So there's really little regulatory or academic attention on PFAS prior to the early 2000s. So we now know, and I'll go into the health effects a little bit more later, but we know that it includes cancers, reproductive, developmental, and immune toxicity. And despite these adverse health effects and despite their widespread presence as drinking water contaminants, there really remains no enforceable federal drinking water standards. Many states, however, have recently taken up regulatory action around PFAS, and I'll discuss more about that later as well. So exposure is pretty ubiquitous. National testing by the CDC has detected PFAS in the serum of almost everyone living in the US, so it's pretty much guaranteed that if you're listening to this webinar, you have these chemicals in your bloodstream. So near universal exposure is due to the widespread use of these chemicals in consumer goods. So you may not have heard of the term PFAS, but you're likely familiar with these chemicals through Teflon and nonstick pans or Scotchgard as a stain-resistant coating. And we find these chemicals in a wide number of products, from furniture to outdoor wear to firefighting foams. They're in children's products as well. And researchers at my nonprofit Silent Spring have they've documented the presence of PFAS in food packaging and dental floss as well. And this research has been widely covered in the media. I included some screenshots from coverage in USA Today and Grist. A personal favorite, though, is when the Onion, the satire news outlet, they covered our research on PFAS in food packaging. And as you can see here, one person, quote, interviewed, unquote, about PFAS in food packaging, said it was the wake-up call that he needed to stop eating burger wrappers. And then while low-dose exposure to PFAS is widespread, we know that exposures that exceed health guidelines are typically linked to living close to various industrial and military sources, as well as landfills, fire training areas, or wastewater treatment plants. As of July 2020, 2,230 locations in 49 states are known to have PFAS contamination. And this map that's up on the screen, it details identified contaminated sites. It's an interactive map, and it was produced by a collaboration between my research group at Northeastern and the nonprofit, the Environmental Working Group. So an academic paper that came out a few years ago, they stated that 110 million Americans have PFAS in their drinking water. This is likely an underestimate, though. There's a more recent report by the Environmental Working Group that sampled 44 public water systems and found detectable levels of PFAS in 43 of them. So for those of you who are familiar with my research institute, Silent Spring, you probably know that we have a strong record of community engaged research. We were founded by breast cancer activists, and we were the first to find PFAS in public and private drinking water wells. Some of the highest detective levels in the Cape have been found in Hyannis. And in 2016, Hyannis instituted a temporary do not drink advisory and implemented new treatment and purchasing from other towns to substantially reduce PFAS in tap waters. So it has been an issue on the Cape as well for those of you who live out there. In our studies of private wells on the Cape, we commonly detect older, phased out versions of this chemical, like PFAS or PFOS, but we also find a lot of these shorter chain versions that industry is really using as replacements because the two older ones have been phased out. In terms of health effects, the Agency of Toxic Substances and Disease Registry, that's a government agency that's part of the CDC, it summarized many of the health effects in a toxicological profile of PFAS. So studies in human populations have been linked to high cholesterol, thyroid disease, preeclampsia in pregnant women, liver disease, and testicular and kidney cancer. Animal studies have found additional adverse health outcomes, including delayed mammary gland development, which of course could have implications for breast cancer. So where does regulation stand right now? As I mentioned before, there's no enforceable water standards at the federal level. There's been some activity at the EPA to adopt standards for two of the older phased out PFAS chemicals, PFAS and PFOA. Many activists, however, are saying this is much too little, too late. There's been increased congressional attention to PFAS at the federal level, including some promising developments, including Congress passed new funding for health studies, and I'll discuss that later. At the federal level, though, a lot of the legislation that's been introduced is stalled. For example, like the House passed a big piece of legislation called the PFAS Action Act last year, but the Senate hasn't taken up companion legislation. So what we're really seeing right now is a lot of the action is happening at the state level. There's currently 25 adopted policies in 12 states and 154 proposed policies in 30 states. So it's quite extensive work is happening at the state level. These policies address many things, including setting drinking water standards, appropriating funds for cleanup, remediation, and environmental monitoring, as well as restrictions on PFAS in food packaging and firefighting foams. And for those of you who live in Massachusetts, you might be familiar, Massachusetts is in the process of establishing a drinking water standard for 6 PFAS. If you get drinking water reports from your town, you'll probably start to see PFAS and the levels that are detected on them. So now that I've gone over some of the background on PFAS, I really wanted to dive into how activism has contributed to the scientific and regulatory landscape in the US. My research group at Northeastern, we have a federal grant from the National Science Foundation to study PFAS activism, and our research has really emphasized that much of the scientific knowledge that we have on PFAS and much of these policy responses to PFAS, it's really been prompted by the activism that's been happening. So there are 2 questions in particular that my research group at Northeastern has looked at. One is, how did a relatively obscure class of chemicals suddenly become one of the most important targets for US toxics activism? So as you might remember, I mentioned that PFAS has been in production and use since the 1940s, but it's only really been in the last few years that we've seen this explosion of activism around this chemical class. So I'm going to describe some of the key scientific events that were themselves really instigated by lay discoveries that have helped support this growth of activism. Another question that we've been really interested in is, why has this environmental health movement been successful at channeling regulatory attention to this class of chemicals? So I'm going to discuss how we've documented how activists have really strategically channeled science, scientific allies, and scientific institutions into making this class of chemicals a significant subject of regulatory attention. So my research group at Northeastern, we've done 35 interviews with activists at 15 sites. This work, however, it's part of a larger PFAS project for which we've done over 100 interviews with activists, regulators, scientists, industry reps, and journalists. We've done a lot of document analyses. We attend conferences and public meetings where we observe activism. But our one of the main things really informing our work is our partnerships with community groups. So this includes co-developing funding applications and research, co-authoring articles, and co-hosting national PFAS conferences, where it's really been community groups who have taken the organizing reins. So what I'll describe first is how community-led discoveries of PFAS contamination, they helped bring about this really important scientific panel and US regulatory testing program. This in turn has provided the framework for the emergence of PFAS activism across the US. So in other words, there's this really long history of industry suppressing public information around PFAS, and it was really this push by concerned residents that made PFAS publicly visible in the first place and helped bring about this really important scientific panel. So as mentioned, despite many decades of use and production and resulting widespread contamination, PFAS was relatively obscure from public and regulatory review for many years. This really started to shift, though, because of an instance of a lay discovery. So namely, the couple in the image on the left, they're the tenants. They connected the die-off of most of their cattle to a nearby DuPont factory. They did autopsies of their cattle. The tenants enlisted an attorney called Robert Bilott to represent them in a lawsuit against the chemical giant DuPont. He's the one featured in the New York Times article, the lawyer who became DuPont's worst nightmare. His work really resulted in DuPont being forced to share thousands of industry sequestered documents that linked PFOA to tumors and cancer in lab animals and factory workers. So after the tenant case was settled, Bilott, he wasn't satisfied though. He went on to organize a class action lawsuit that represented 80,000 exposed residents in the region. And what was really novel about this lawsuit was it didn't just result in getting a payout to the people who were part of the class action lawsuit. It was centered around DuPont having to pay $70 million for a court-ordered epidemiological study of impacted residents. So this was referred to as the C8 Science Panel. And if you're interested in this history, you can watch the recent film Dark Waters. You get to see Mark Ruffalo play the lawyer Bilott. So the C8 Science Panel, it ultimately enrolled 69,000 participants and concluded there was a probable link of PFOA to 6 diseases, including 2 cancers. The C8 Science Panel, though, really set the stage for the emergence of later activism. So almost unanimously, the activists we interviewed for our Northeastern University research, they're familiar with the C8 study. Many of them have mobilized the results of the C8 study to try and convince health officials of PFAS adverse health effects. So as one activist we interviewed stated, we're very familiar with the C8 health study because we've referenced that a lot. When regulators say there's no known health effects, we're like, really? Look at the study of 69,000 people. How can you say that? And moreover, the class action lawsuit, it really brought PFAS within regulatory purview. So after that, the EPA fined DuPont over $10 million for failing to report substantial risk of injury to human health. In the years that followed, the EPA would add 6 PFAS chemicals to their UCMR3 program, and that program requires testing for PFAS in public drinking water systems. So many communities across the US became aware of PFAS contamination because of this UCMR3 testing. So the tenant discovery, it was really phase 1 for pushing information about PFAS out into the open. We're currently in what I think of as a second phase now, where we do have more evidence of harm. We know about widespread exposure. So I'm going to describe how PFAS activists have been very much involved in pushing for the expansion of this research on the harms and extent of exposure. So I outlined 3 categories for how activists contribute to policy relevant science. The first 2 categories, they really encompass ways that activists advance relevant scientific knowledge through creating scientific infrastructure such as government-led health studies and directly participating in research. The third category illustrates how activists align already existing science and scientific allies with their political demands. So across the country, activists have really targeted government institutions to create new scientific mechanisms to study PFAS. This includes blood testing programs and health studies. So in particular, some groups have really successfully organized around obtaining state-funded blood testing programs, which they then have translated into broader community organizing and media attention. So for example, there's a picture on the right of your screen. This was a picture taken by the PFOA Project New York. They're an activist group in Hoosick Falls, New York, and they broadly expose community contamination by posting pictures of residents' blood results on Twitter. So the photos of children in particular, these have really been taken up by subsequent local and national media coverage. Activists have also advocated for government funding for health studies that prop up activism to lower exposure. So for example, activists were really key players in securing $27 million in federal funding to assess PFAS exposure at 8 military US bases and for a multi-site health study of 7 other sites. And this multi-site health study, it's really aligned with the activist goals. It's going to advance understanding of the relationship between exposures and health outcomes. And according to a statement before Congress by the director of the government agency who's overseeing this research at the ATSDR, it also could result in government recommendations to further lower exposures. So for this multi-site health study of 7 sites, Silent Spring is leading the study for one of the sites. Silent Spring was awarded $1 million to study the health effects of PFAS in drinking water in Hyannis and Air, Massachusetts. So MBCC is a partner on this research and will help recruit 1,000 adults and 300 children from Hyannis and Air, as well as contribute to other research activities such as we'll be sharing the results with participants. To make a very slight divergence from PFAS, I think it's a really interesting strategy that PFAS activists have targeted Congress to create money to study the links between exposure to PFAS and adverse health outcomes. It has a lot of parallels with a key strategy that was used by breast cancer activists back in the early 1990s. So breast cancer activists in places like Massachusetts and Long Island, they successfully advocated for congressional funding to study the links between breast cancer and the environment. For example, it was MBCC's work in this area that established Silent Spring as a research institute to study the links between breast cancer and the environment. So while there's still a long way to go, there have been new research programs that have established evidence of the links between breast cancer and environmental chemicals, and we have now expert panels who are recommending reducing exposure to environmental toxicants. So I think that there's just very interesting parallels between the strategies that we see PFAS activists adopting today and those that were spearheaded by breast cancer activists about 25 years ago. So another way that activists have shaped policies by participating in the production of knowledge through citizen-led science research and scientist community partnerships. So for example, in an early case of citizen-led science, Hoosick Falls resident Michael Hickey, he was suspicious about the links between his father's death to kidney cancer and industrial pollution from a local factory that made a substance similar to Teflon. So Hickey's internet research, it led him to conclusions of the C8 science panel that linked PFOA to kidney cancer. Hickey collected water samples from his own tap. He paid for them himself to be analyzed by the same lab that the C8 science panel used. These results ultimately revealed high concentrations of PFAS. After years of advocacy by Hickey and others, the New York State Department of Health, they would eventually perform blood testing of residents in Hoosick Falls. And since receiving their biomonitoring results, Hoosick Falls residents have been organizing around environmental remediation and policy change. The picture of the children holding up their results, that's from Hoosick Falls. And then in an example of community-based participatory research, a local advocacy group in Merrimack, New Hampshire, they conducted a community health study in collaboration with researchers at the University of Vermont, Burlington, that documented really elevated health concerns for several vulnerable populations and long-term residents. And this health survey really supported local organizing in New Hampshire, and there's been a lot of activist organizing in New Hampshire, and it's really translated into a proactive state when it comes to establishing drinking water standards and taking other action to address PFAS contamination. And finally, activists have really taken advantage of a recent increase in funding for PFAS research from federal agencies such as the National Science Foundation and the National Institutes of Health. As one example, my colleagues at Silent Spring are collaborating with MBCC on a $2.6 million National Institutes of Health grant that will examine PFAS immunotoxicity in children. The grant is called PFAS-REACH. And if you live in Hyannis and want to be part of the PFAS-REACH project, then you can. Participant families receive reports with results of their children's PFAS concentrations and antibody testing, $100 in gift cards as a thank you, and just the satisfaction of knowing that you're helping improve our understanding of PFAS health effects in children's health. So enrollment is open, and you can learn more about eligibility by contacting the email on that slide. And I believe my slides will be available after this presentation, so you can access them for any email contacts or web links that I share, or you can also reach out directly to me and I can pass on the information to you. And as a final way that PFAS activists have influenced PFAS policy and science, so activists, they've not only created new knowledge about PFAS, they've also translated existing scientific discoveries and leveraged scientific allies into successful political organizing around PFAS regulations. So in many cases, the activists we've interviewed frequently told us about the importance of scientific allies, for example, scientists who sit on community boards or act as consultants for them. But in general, activists have, we've seen activists have really developed a sophisticated knowledge of PFAS science. So for example, Emily Donovan, who's featured in the slide, she's the co-founder of the North Carolina group Clean Cape Fear. She has testified at multiple federal congressional hearings on PFAS. And during that, she's referenced research, for example, by the National Toxicological Program on pancreatic tumors and academic research. And she's also referenced academic research that's detected local cancer clusters associated with elevated PFAS risk or elevated PFAS levels in residents. In particular, though, we really see activists are mobilizing existing science to pressure states to establish stringent drinking water standards for PFAS. These drinking water standards are otherwise known as MCLS. So in this work, activists have often advocated for a regulatory standard of 1 part per trillion for all PFAS compounds. This is in comparison to right now, as I mentioned, there's no federal regulatory standard, but there is a guideline, and that's 70 points per trillion for 2 PFAS compounds, PFOA and PFAS. So activists are advocating for a much, much lower standard to be adopted. And this was primarily selected based on an EPI study from Harvard that concluded that this level would adequately protect children against adverse effects on the immune system. So in the past couple of years, 7 states have developed MCLs or health guidelines for PFAS, and in many cases, this adoption of water quality standards was instigated by community pressure, community petitioning. So for example, it was environmental groups that successfully petitioned the Commonwealth for a strict drinking water standard. This is an article in the National Law Review that describes the activist-led petition in Massachusetts, and here's a picture of MBCC's executive director, Cheryl Osimo, testifying at a public hearing urging Massachusetts to adopt a strict standard, which they recently have. As another example, New Hampshire's developed MCLs for 4 PFAS following activist organizing in locations such as Portsmouth and Merrimack, New Hampshire. So activists really opposed New Hampshire's initial draft regulatory standards that were higher than other states. In the wake of this public pressure, and also informed by a new tool from Minnesota that took into account infant exposures from breast milk, New Hampshire did adopt or did revise their MCLs to be some of the lowest levels in the nation. So a PEAS activist that we talked to, she really talked about the influence of community advocacy in getting the state to take to consider the best available science and act in a precautionary way. Like she told us, they said a big piece of that was the Minnesota tool that gave them the scientific evidence they needed, but I also feel like it was really strong community leadership, public comments. It was a group efforts. When those first numbers for MCLs came out, we really came back hard saying this is not okay. That's important, especially when industry is trying to get it to go the other way. So as I mentioned, a lot of states are currently adopting or considering bills aimed at regulating PFAS. So for those of you who do live in Massachusetts and would like to plug into this, there are bills in the House and Senate that would prohibit the sale of PFAS containing food packaging that contains PFAS. There's also bills that are aimed at restricting the use of PFAS in firefighting foams. And MBCC has really been doing a lot of work in support of legislation that would ban PFAS in food packaging in Massachusetts. So for example, MBCC has been doing outreach with high school students, educators, and caregivers across Massachusetts to join a letter writing campaign to state legislators. So on MBCC's website, you can find more information about this campaign around PFAS in food packaging, including information on how to contact your local Massachusetts legislators in support of the bills, as well as tips on letter writing. And there really is a New England precedent for adopting restrictions on food packaging. So Maine has already banned the use of PFAS in food packaging, and there's also efforts underway in Rhode Island, in New Hampshire to follow suit. In these states, it's also been very much activist pressure, which has really introduced these bills into the legislature. So to summarize, activists have been really critical in shaping PFAS science and regulation across the country. They've pushed government officials to conduct water and blood testing. They secured millions of dollars in federal funding. They've petitioned states to adopt water quality standards and consider restricting PFAS in products, just as some examples that I've touched on. And I think this contribution of lay expertise to scientific knowledge and policy, it really just warrants emphasizing, given that regulators and industry frequently dismiss communities when they express health concerns. We've seen this in PFAS and we've seen this in other toxics works. Our work, however, has really demonstrated that much of the knowledge that we have about about the harms from this class of chemicals, it has origins in community-based advocacy and research. And while science has really aided this toxics activism, the nature of that science is really critical. So the activists we've interviewed, they've really benefited in their organizing from scientific research that is public, that is collaborative, that returns their personal and community-wide results, is more holistic than a traditional chemical by chemical approach. And I think that's why it's so important that we have government funding for these research studies that really support these collaborations between activists and researchers. So I wanted to wrap up the webinar by sharing some resources that might be helpful for you or your community. I mentioned that Silent Spring and MBCC were collaborating on a federally funded research project called PFAS-REACH that looks at the effects of PFAS exposure on children's immune systems. The project has developed an online resource center called the PFAS Exchange that provides fact sheets on PFAS. It facilitates connections across communities, and it also has a data interpretation tool for people who have received PFAS blood and water testing results. The website URL is on the bottom of the slides, which, as I mentioned, should be available after the webinar. And on the PFAS Exchange page, you can click on a tab. It says Connecting Communities. It will take you to a map that lists contaminated sites across the country and also has information about active community groups in different states, as well as information about health studies that are occurring across the country. So for example, you can click on Massachusetts and it will give you a link of contaminated sites in the Commonwealth. It'll list information for active community groups like MBCC that you can connect with. And it also has information about active health studies like PFAS-REACH in case you're interested in following the science or in some cases even participating in a study. PFAS Exchange also has a data interpretation tool that will help you understand your results from PFAS blood or water testing if you do end up getting your blood or water tested independently, or if you participate in a study that shares your results. Sometimes you'll get your results back in a format that's really hard to interpret. So this tool was really just designed to help people interpret their results in a meaningful way. So you would basically enter your test results that you get back from the lab or the government agency, and you end up with a report that shows you how your levels compare to state and federal health guidelines, that gives you information about health effects, and it also shares tips for reducing your exposures. So the PFAS Exchange website, it also has fact sheets for exposure reduction, health effects, drinking water treatment, and it's soon going to have information about how to talk to your doctor, as well as resources for physicians themselves to educate themselves. And the physician resources added here are really something that activists have been pushing for. So like as one activist told me once, you can give people back their results, but where are they supposed to go from there? Like what are they supposed to do with that information? So the physician education, it really helps community members and their doctors proactively identify PFAS-associated health outcomes. So for example, impacts on liver function, and it helps, once you can identify those early enough, it might help with interventions to slow down or stop the progression of disease. So community members really have been pushing for physician education, and that's why the PFAS Exchange will be a portal that provides physician relevant information. If you're interested in tracking what PFAS policies have been adopted or are being considered in your state, then check out the Safer State Spill Tracker. It's a really great way to keep up to date about different initiatives across the country. And I'll also invite you to connect with me if you're interested in the work my group at Northeastern University is doing around PFAS. So we've organized 2 national conferences that have brought together community members, scientists, policymakers, journalists, and so on from across the country. We also have a website, www.pfasproject.com, and this website includes almost daily links to news articles about PFAS as well as other resources. We have an e-newsletter that you can sign up that includes information about what community groups and scientists are doing around the country to address PFAS. And while it's not PFAS specific, you can also download Silent Spring's free smartphone app, Detox Me. It includes over 270 research-based tips on how to reduce your exposure to harmful chemicals like PFAS and beyond. Okay, so I'm just going to wrap up and just say thank you so much for joining me. I've listed my email contact on the acknowledgement page, so please feel free to reach out if you'd like any more information on what I've spoken about today. And yeah, I'm happy to take any questions.
Thank you, Jenny. We do have a question that came in regarding, it says on the Cape Cod, more attention is being given to the N pollution from septic systems, which has caused water quality problems and habitat loss in coastal embankments. Much less attention is given to PFAS contamination of our public and private water sources. Mm-hmm. Why do you think that the N pollution is receiving attention and the activism of around PFAS hasn't taken hold?
No, that's a great question. I think maybe because the septic system issue, it's been an issue that there's long been sort of research and awareness on PFAS or on the Cape, whereas the PFAS issue, we've really just seen a spike in interest in organizing in the last couple of years on the Cape. So I'm hoping though, there are a lot of active community groups right now on the Cape who are bringing attention to this issue. So, and there's been a lot of increasing media attention to it on the Cape. So I do think that it is starting to gain a lot more resonance on the Cape as well as an issue.
And Jennie, can you speak to addressing this issue of the kind of whack-a-mole approach to PFAS that, you know, with so many chemicals, so many under this class of chemicals, driving legislation to address it as a class versus, you know, a one-off or 6 here or 4 there?
Yeah, no, that's a really great question too. Like as I detailed earlier, there's over 6,000 compounds that are in this class right now. There's more being added to it yearly, and we know that it's a strategy that's really been used by industry in the past. When we identify a couple of key chemicals of concern, they'll usually replace it with ones that are pretty structurally similar to it, but have not been as extensively studied or regulated. So, and I think like we've seen that issue in with chemicals such as BPA, where industry we know has replaced it with BPF or BPS, and activists have been very sort of aware of this dynamic, and PFAS activism has been very interesting in that I think it's one of the activisms that we've seen around toxics that has really tried to get ahead of this by focusing on PFAS as a class, not on just individual chemicals like PFOA or PFOS. So right now, a lot of the activism is really pushing for like water quality standards that take into account the whole class of the chemicals. We haven't really seen that happen yet, but we have seen states adopting regulations, for example, in Massachusetts, that regulate 6 PFAS chemicals and the sum of them. So it's not a one-by-one chemical approach. So it is an improvement over things that we've seen in the past. We also see food packaging bills, for example, right now that are aimed at the entire class. So at restricting the entire class of PFAS from like children's products or food packaging. So there has been a lot of, I think activists have been very savvy around class versus individual chemicals and trying to avoid this whack-a-mole dynamic that we've seen in other cases, and have really organized specifically around PFAS as a class. Yeah.
Great. Well, Jennie, I want to thank you for your time today and for all of the information that you've provided to us. On behalf of Cheryl Osimo, MBCC's Executive Director and our Board of Directors, we value the presentation that you've given us today and the information that you've provided, as well as the support and partnership that we've had with you on projects in the past in our sister organization, Silent Spring Institute. And to our many listeners, I would like to thank you for joining us this afternoon. As Jennie mentioned, this webinar will be, a recording of it will be available on our website later today, and you'll have full access to her slides and some of the valuable resources that she shared. Please look for that information to be up by late this afternoon. And with that, I thank you all and wish you a good afternoon.
Great, thank you.